In this video, we're going to introduce you to generic professional capabilities. Generic professional capabilities, or GPCs, were developed by the GMC in response to common themes in concerns around doctors' performance and reports from high-profile safety inquiries. The Shape of Training Review also recognised the importance of developing a GPC framework, which was developed in conjunction with the Academy of Medical Royal Colleges and other stakeholders and published by the GMC in 2017. The GPC framework gives a detailed description of those capabilities that are essential to deliver safe, high quality and effective practice as a doctor in the UK. It's required that GPCs are embedded within training curricula, and doctors in training must demonstrate the achievement of these generic outcomes by CCT. The Generic Professional Capability Framework is divided into 9 main domains. 3 of these are inherent in all we do as doctors: professional values and behaviours, professional skills, and professional knowledge. There are also 6 other themed domains: capabilities in healthcare promotion and illness prevention, capabilities in leadership and team working, capabilities in patient safety and quality improvement, capabilities in safeguarding vulnerable groups, capabilities in education and training, and finally, capabilities in research and scholarship. Each domain contains a number of descriptors which lay out the particular capabilities and behaviours needed to meet the regulatory requirements and describe the minimum core content of curricula for all specialties across medicine. In other words, these are the things you need to know and be able to do in order to be a doctor. For example, if you look at the Professional Values and Behaviours domain, it contains the descriptors you can see on the slide. I'm sure you agree that all of these are needed to be a doctor in any specialty, including surgery, and poor performance in any of these areas would leave a significant hole in someone's ability to deliver safe, effective and high quality care. Each of the 9 domains contains descriptors of capabilities that, when brought together, describe what is needed for consultant practice in that domain. Assessment of the performance of a trainee against GPC domains needs to be at the centre of how we assess a trainee. But we don't have to assess each individual descriptor, quite the opposite. What we're after is a professional, holistic judgment of the trainee's capability in that area, assessed against the trainee's stage of training. In order to do that, we do need to have an understanding of what the descriptors are, but all we need to do is indicate that a trainee is developing in each area appropriate for their stage of training, or that there are areas that require development over the next training period. Previously, identifying an area for development, especially in non-technical areas, was often challenging, and we often struggled to put our finger on precisely what the area was, or found it difficult to find appropriate words to describe the area for development. If we can't describe the area accurately, then we can't feed back to the trainee with clarity on where they should concentrate their efforts over the next training period. With the GPC descriptors, we have a thorough breakdown of all those tasks and can more easily identify and find language to describe the area for development, improving feedback and helping trainees to develop safely and perhaps more quickly. We've integrated the GPCs into all surgical curricula, and areas for development can be effectively identified through the multiple consultant report, and trainees can identify areas they themselves think they should work on through trainee self-assessment. We'll show you how to do this in the videos on the multiple consultant report and trainee self-assessment. In essence, be aware of the content of the GPC domains and their descriptors. Come to a professional, holistic, high-level judgment of the trainee's capability in each GPC domain, based on your knowledge of the domains and on the trainee's stage of training. If you have concerns, illustrate your decision by selecting a small number of descriptors as examples of areas that need development over the next 3 to 6 months. In summary then, the Generic Professional Capability Framework describes all the essential knowledge, skills and behaviours a doctor needs to practice safely and effectively, to be that doctor that you or your family would like to see. In order to develop these capabilities, the GPCs have to be at the heart of training and assessment, giving us the ability to improve feedback, address problems early, and develop the next generation of high-quality consultant surgeons.